viewers, I'm here to give you a COVID update from your community hospital here at Swedish Issaquah. Thanks for having me. I want to share a little bit of data. There's a great dashboard here that gives us kind of the outlook of what's been going on with COVID infections since 18 months ago. So you can see here on the screen, we've got a time lapse and it shows peaks here. And you might wonder why we've been calling this the fifth wave. If you can see, we've got a number of different peaks back last spring, last summer. We've got over the winter months, this most recent spring, and here we are out here at the right. And we are currently in wave 5 for King County. What's interesting is even though we've had a lot of cases here over the last few weeks, and there's a lot of scare around Delta, I wanted to share this because you need a moment of hope to start with. And so here's your moment of hope, is that we did have quite a few deaths last spring and over the winter months, but take a look right here where July and August meet at the right-hand side of our screen. The death count is still really low, even though our hospitals are really stretched and we've got a lot of cases on the rise. We don't have a lot of people dying of COVID. We still have deaths, but the number of deaths has not been as scary with this round, with this 5th round, as it was with the previous round. So there's a moment of hope to get you started. Now, what is Delta? There are lots of different variants of the COVID virus. And you can see here on the left of the screen, this is dating back even in June of this summer, all the different named variants. And Alpha is kind of the original and they go through a sequence, but there are a lot of others here that you probably haven't heard of that are not very consequential. But you can see this Delta variant becoming a greater and greater proportion of the COVID positive tests. And in our area here by the end of July and early August, the vast majority of the tested positive COVID cases in our community are the Delta variant. So what's so special about the Delta variant? So it turns out Delta is about twice as transmissible. So a little over 2 times as contagious as the original COVID strains that we were navigating in the early pandemic. The other thing about Delta is we do see what are called vaccine breakthrough cases. So a breakthrough case is when someone is fully vaccinated, but they actually get infected with the Delta variant COVID. And so this looks at February through July. For those of you who like numbers, I've got lots of numbers and graphs for you today. This shows that about 92% of the COVID cases between February and July were in not fully vaccinated people. So this shows that 92% of the COVID cases between February and July of this year were in the unvaccinated groups. But we still have an 8% number depicted here. So 8% of our COVID cases in our community, spring and summer, are in fully vaccinated people. And what's interesting about Delta is it's easier to have a breakthrough case with Delta than it is with the early variants of COVID. And that's kind of what this shows. This is a lot of numbers and we won't dwell here for very long. But when you look at all of the breakthrough cases, so if you look down here, 2,400 breakthrough cases, this is in fully vaccinated people in our community here in King County, 2,400. These are fully vaccinated cases through the state of Washington, 2,400 total cases of breakthrough COVID infection. And of those, 58% were the Delta variant. So what this graph means is Delta is more likely to break through and cause infection in somebody who's fully vaccinated. Now, the good news is our vaccines are doing an outstanding job of preventing severe disease, ICU admission, ventilator need, and death. But that does mean that those of us who are fully vaccinated can contract the Delta variant of COVID, and during that time, we can transmit it. We do tend to have a shorter case, and so we don't need to keep away from others for as long. Typically, we recommend 7 days of isolation if you do get a positive COVID test and you're fully vaccinated. And obviously, you'll want to contact health authorities to help you with navigating how long you should be in isolation and how to protect your loved ones. So this graph looks at hospitalization rates and death rates from the Delta cases in the state. So this is just 2021 data. And it shows you that of all of the positive cases of COVID in Washington state, about 6% of them were hospitalized. So that's 58 out of 1,000 cases were hospitalized. And of those, 8 out of 1,000 cases of COVID actually died from COVID. And that's all the variants here in this left box. But if you look over here in this right box, you can see this is the Delta variant. So only 38 out of 1,000 cases were hospitalized with the Delta variant, and only 4 out of 1,000 cases died from the Delta variant. So even though Delta is twice as contagious, twice as transmissible, you're half as likely to be hospitalized and half as likely to die from the Delta variant in all cases, whether you're vaccinated or unvaccinated. So this is part of why we're seeing the need for vaccinated folks to wear a mask again and socially distance, is we can be perfectly healthy and asymptomatic, and we can transmit that to vulnerable people in our community. So this is what it looks like at Swedish. This is data from August 27th. So this shows all of our hospitals. We have 5 hospitals, one of which is our Issaquah Hospital. And you see there we had 81 that were hospitalized as of last week with COVID. Of those, 70 were unvaccinated and 11 were vaccinated. But if you look closer in the ICU, we had 35 cases in the ICU. That's a little under half of our COVID cases are in our ICUs. And of those, all of them were unvaccinated. So the good news is that the vaccines are doing a great job at preventing the severe disease, the need for using a ventilator, and death. But our unvaccinated neighbors are still at risk. And some of those folks don't really have a choice. Some of them can't get vaccinated. Those who are immunocompromised may get vaccinated, but still be vulnerable. And none of our kids under the age of 12 can get vaccinated. And we have had some pediatric admissions in our community. So I just wanted to show you this. There's really a small percentage of people who are fully vaccinated that still get COVID-19. So if you look at all of the cases, I showed you a number earlier, it was about 8.2%. That's just in 2021. And so if you look at, since we've had vaccination data, robust vaccination data, this shows that same ballpark number, around 7.3% of all confirmed cases between February and August were fully vaccinated. So like I said, about a 7 to 8% chance of you contracting COVID if you're fully vaccinated. That's pretty small, but it's enough that you should wear a mask and socially distance. When you look at the number of people who were hospitalized, of all of our hospitalized cases of COVID, only about 6% were vaccinated. And if you look at all COVID deaths between February and July, about 7.6% were in those who were vaccinated. However, among those who were vaccinated and who died of COVID, the majority of those were patients who had immunocompromise, for which case their vaccine may not be as effective as it is for someone else with a good immune system. So let's look at how vaccination is doing across our state. This is a really neat map, and it shows by zip code the percentage of fully vaccinated folks ages 12 and up who have completed both shots and are 2 weeks out from their last shot. So you would expect these folks to be pretty resilient. There's a minority of them that can still get COVID, like we said, 7 to 8% can typically still will contract COVID. But if you look at our community right here, this is 98029, 91.1% of our zip code is 2 weeks past fully vaccinated, and that's all the way down to age 12. And then more than 95% of our Sammamish neighbors here are fully vaccinated. So this is really impressive that the East Lake Sammamish community has some of the highest vaccination rates in the state. This is really encouraging for those of us who are out and about in the community. And it's a little concerning that we do have some surrounding neighbors whose vaccination rates are not as robust, but we're making some headway there. So I think this is really encouraging that you and your neighbors have done a great job of helping support your healthcare community and those of us who are trying to take care of you in the hospital. All right, and so if there's any question as to whether or not people are getting vaccinated, I think we hear those voices on social media, in news outlets, among our friends, in our social circles. We hear the very loud minority of folks who might be an anti-vaxxer or even just a skeptic. So I just wanted to give a plug that, physicians tend to be pretty skeptical of data, and we're going to scrutinize that with the scientific eye, like many of you do. And this latest survey by the American Medical Association, this was in July, before probably all of us had been vaccinated. And even in July, those of us out here on the West Coast, 98% of physicians are vaccinated out here. So please let us be kind of a model to you. We've also been a test subject in many ways. We're happy to take that burden because it gives us protection against COVID so we can take care of you. All right, so the big question at hand is boosters. Do we need boosters? Do we not need boosters? For those of you who already have an immunocompromise, you're on immunosuppressant medication, you've been treated for cancer, you have an organ transplant, many of you are already eligible for a booster shot and they're already being delivered here in our community. Please check with your physician or your healthcare provider to see if you're eligible for a booster shot. Shot number 3 is available to those of you who are immunocompromised already. However, just yesterday, the CDC met and discussed, are the rest of us going to need a booster shot? So that's kind of what this chart is showing you is, what does it look like? How effective is the COVID vaccine against infection over time? So if you look, pre-Delta is the green bar and the red bar is Delta. And you can see, how effective is it against just infection? Like, are you and I going to get COVID after our vaccine? And then how effective is it against severe disease? So here on the right, you can see those numbers look really different. So as you compare geography to geography, it looks like we are more at risk for infection with the Delta variant after vaccination here in the United States. And similarly, we may have seen pockets of that in Israel, whereas in the UK and New York State, there may be better efficacy. Whereas against severe disease, we all have retained a fairly robust immune response against severe disease. The vaccine is still effective at preventing severe disease. So as of yesterday, the latest news I heard is that we're probably not going to need boosters. However, the state is readying later this month that if that decision changes or if there's an actual statement that comes out for different groups, whether you're a healthcare worker or a non-healthcare worker, what does it look like for our geography? All of those things will come together in a robust recommendation later this month as to who needs to get booster shots and when. So stay tuned. We'll try and provide some updates on our Swedish webpage for that. Elective surgeries are still happening at Swedish Issaquah, but we've had to cut them by 50%. So we have a surgical decision-making committee that goes through each individual surgical request and makes a decision about which one should be priority and which one shouldn't. And this is absolutely heartbreaking for us because many of you with elective surgeries, I got to tell you, it doesn't feel elective when you've had 5 years of knee pain and you need your knee replacement, right? That doesn't feel elective. And to postpone those surgeries has been really tough on our patients and on our surgeons and nurses. So please know that our hearts go out to you. My fear is that as our census is still kind of rising, chances are that that may get even tighter until we get some relief. So Swedish Issaquah, actually treating our community, we're doing quite well. We're not seeing a lot of our local residents in our building. In fact, we've taken a higher number of COVID admissions from outside our county. We as a system are experiencing a higher census coming from smaller rural hospitals in Eastern Washington. So there is a coalition for the state that is helping decide how to distribute patients. And we're taking a larger proportion of those Eastern patients into our ICUs and into our hospitals. So as far as the census goes, we are still on the upslope, even though county cases look like they might be plateauing. In fact, the way we measure kind of where we are on that trajectory, on that bell curve, is we look at test positivity and we also look at the rate of doubling. And we've seen the rate of doubling has actually dropped. So last week, we would double the number of COVID cases in about 14 days. And that's now down to about 21 days. Now that means our case numbers are still growing, but they're growing at a slower rate. And so that means we're probably approaching a plateau. So that's encouraging for King County. That doesn't seem to be the case with Eastern Washington and with Southern Washington. Those areas continue to be on an upward trajectory, and that rate of change hasn't leveled off. So that's part of why we're seeing increasing numbers of people in ICUs and in our hospitals with COVID, even though we think King County looks like, thanks to our vaccination rates, we're starting to level off as far as the percent positive tests here. So let's talk about kids under 12. So there is not yet authorization or FDA approval for use of COVID vaccines yet in patients under the age of 12. That is forthcoming. As you know, the FDA has a scrutiny process. They have to have a certain number of cases to observe, and there are volunteers that have received the COVID vaccine under the age of 12, and they're being studied and monitored carefully. But we're not ready to roll that out to the public until we know what those effects are and whether it's an effective vaccine for that age group. We also need to make sure that the dosing is appropriate for an under 12 age group. So more to come. It's anticipated that it will be approved for kids under the age of 12 in the fall, later in the fall, which feels frustrating because here they are all going back to school, most of them today. And so we're relying on ISD. They've done a great job putting together their COVID mitigation strategies that includes mandatory masking in the building, social distancing to 3 feet within the schools. Those are all strategies to help protect their kids in a setting where, and I didn't mention the improved ventilation system. They've done quite a bit of work in that area too. So we're hopeful that we can get our kids vaccinated, but we're not there yet for the age under 12. For those between the ages of 12 and 18, it's safe to get your teenager vaccinated. Both of my teenagers are fully vaccinated, and it's definitely recommended. As for pregnant women, there was a little hesitation early in the pandemic because we just didn't know very much about the impact of the COVID vaccine in pregnancy. And sadly, there's been a little delay getting pregnant women vaccinated. We have a number of different organizations that are now fully recommending vaccination for pregnant women during any stage, whether you're in the first, second, or third trimester, or whether you're trying to get pregnant through natural means or even through in vitro. All of those patient groups are now eligible and recommended for vaccination. In fact, we've now discovered that breastfeeding women can transmit COVID antibodies through breast milk to their newborn and provide protection to their newborn baby against COVID through breastfeeding. So there's some really hopeful news. That's set against a backdrop of a number of pregnant women who've landed in our intensive care unit. Unfortunately, pregnant unvaccinated women are at even heightened risk of COVID. Pregnancy is an immunocompromised state in itself. You're more prone to getting a cold in general, and you're more prone to getting COVID, which means it's even more important to get the vaccination because we've had a number of cases where we've had to deliver a baby prematurely so we can help mom breathe better with COVID. And we've lost a few pregnant moms here in the Puget Sound area. So those are preventable deaths through vaccination. So please take the opportunity to get out and get vaccinated. So there's a lot of misinformation out on the internet. And one of those that I hear pretty commonly is, oh, well, you know, the mRNA vaccine gets into my DNA. And so for those of you who know genetics, messenger RNA comes into the cells of your body. It provides a blueprint so that you can make the proteins that will allow your immune response to fight, build antibodies to fight the COVID vaccine. And that messenger RNA actually gets broken down in the cytoplasm. It never goes into the nucleus of your cell. It doesn't become integrated in your DNA. You're not going to pass it on to your children. So that fear can be dispelled. As for, there's another myth that the COVID vaccine will affect my fertility. So there's no data to show that COVID vaccination will impact your fertility, either positive or negative. It's safe to get the COVID vaccine while you're contemplating pregnancy. And in some ways, you can protect your unborn child through getting vaccination yourself. The ingredients of the COVID vaccine are listed in the package insert and can be accessed online. The Johnson & Johnson, the Moderna, and the Pfizer vaccines have made their ingredients fully disclosed. They have to, as being part of an FDA approval process. They have full disclosure. So none of them were developed using fetal tissue. I know that's been a concern that people have asked me about. They do not contain any residual materials like implants or microchips or tracking devices. So the thing that tracks us most readily these days is this nice little phone that I have in my hand. That's a much more reliable tracking device than your COVID vaccine. No trackers, implants, microchips, or anything like that are contained within those COVID vaccines. That's a loaded question. Our staff is really burned out. They've been overworked, they're exhausted. And we would all really like some rest. And we're relying on all of you to be responsible and hang in there. None of us want to go back into masks. None of us want to limit our activities in the public. But we are running on empty. And we're struggling to ensure that we have enough staff to deliver this surge care that we need during this month in particular. All hospitals are really hurting right now for nurses and respiratory therapists and folks helping out in the ICU and in the emergency department and on our hospital units. We're stretched quite thin. And people have taken a lot of long shifts and a lot of shifts, and they're exhausted. I saw a really poignant quote. I'm going to read it. It says, "If you love a healthcare worker, pray daily that God will renew their passion, joy, and contentment in their calling. Because while the world fights over a shot, the medical field is fighting to keep their desire to serve." And we're seeing that. We've lost nurses who've retired early or moved on to non-critical care areas because life is easier in those spaces. And it's really tough when folks are making choices that result in their own risk, and then we have to manage that risk. So please do what you can. If you yourself haven't been vaccinated, please talk to a reliable healthcare worker, get some data, get some information, and be informed. Make sure you're choosing reliable sources of information. Typically, social media is not the most reliable source of truth. Please talk to your healthcare providers. So if you're not vaccinated, get vaccinated. If your entire family that's eligible for vaccination has not yet been vaccinated, please talk to them and encourage them to do so as well. In addition, if you have emergency care needs, if you need to come to the ER, come to the ER. We will treat you here. However, if you have a non-emergent care need, seek that out in your primary care physician office or at an urgent care or quick care center where you may have less exposure risk, and you can ensure that we have the ER designated for those highest need cases. And lastly, please use your mask. I know that nobody wants to go back into our masks, but please wear your mask in public spaces, continue to physically distance, avoid crowds, and limit your time indoors, especially for unvaccinated family members like your kids that aren't eligible or your vulnerable family members who cannot get a vaccine. We still need to pretend like we're in a pandemic because we are. So we really appreciate all of your commitment and your responsible actions and your voice and your support. We really rely on that to help get us through this tough time. So thanks to all of you for helping us out.